Looking now at the inside of the heart. Okay. So your right atrium is going to be up here. Your left atrium is going to be up here. Your left ventricle is going to be down here, and you know because it has the thin wall. Okay. Your left ventricle is going to be down here, you know, because it has a thick wall. Okay, and then the wall in the center is the interventricular septum. Okay. Now, between the right atrium and the right ventricle, you're going to have these flaps of tissue that have little strings attached to them. Okay? This is part of the tricuspid valve or the right AV valve. The tiny little strings that are attached to it, those are called chordae tendineae, and the bumps that the chordae tendineae attach to are called papillary muscles. So this prevents the blood from going from the right ventricle back into the right atrium. The chordae tendineae and the papillary muscles make sure the valve doesn't get pushed the opposite way. Okay? Now, blood in the right ventricle is going to be squeezed up into the pulmonary trunk here. Okay? When the blood is squeezed into the pulmonary trunk, it's going to pass through another heart valve called the pulmonary valve or the pulmonary semilunar valve. And you can see those flaps here. There should be 3 of them. Okay, so 1, 2, 3. Pulmonary semilunar valves. Okay? Now, on the left side of the heart, when blood comes down from the left atrium down into the left ventricle, it will pass through a valve called the bicuspid valve or the left AV valve, or sometimes it's called the mitral valve. That one will also have chordae tendineae attached to it, and it will attach to much bigger papillary muscles like that one. Okay? When the left ventricle pumps blood, it's going to push blood up into the aorta here, and it will again pass through a semilunar valve called the aortic semilunar valve. So part of the valve is there, the other part of the valve is on this side. Okay, so right there, it looks like we cut through it right there. Oh no, there's the other one. Right there. So 2 here, and 1 here. 3. Okay. Alright, that's it.